America's nursing shortage may only get worse, and now some groups are proposing dramatic steps to hire and retain nurses. The National Desk's Angela Brown joins us right now. You know, Angela, new numbers about how many nurses are considering quitting is pretty alarming. And this has been ongoing, though. This is not something new.
Right. I mean, we've been living through a shortage throughout COVID, and now we're learning that a lot of nurses are really walking away or want to walk away from their jobs. A new poll says 50% of nurses say they have considered quitting, leaving a big hole in healthcare, already struggling to hire and retain workers. This morning, we're tracking what is being done to stop the bleeding. Let's start, though, in Arizona. And their Hail Mary to keep nurses coming in the form of legislation. The Oregon Nurses Association proposing a bill that will be passed on to lawmakers to require hospitals to have a minimum number of nurses for the number of patients and make it enforceable with fines. Our team in Portland interviewing Paige Spence from ONA.
By establishing these standards into law, we're closing the loopholes that some hospitals are currently exploiting to have fewer nurses at the bedside.
The pressure on overdrive to keep and hire nurses. In Texas, for example, sign-on bonuses nearly doubling. You can see there, California, the average salary 20% higher than the national average, not to mention a global bidding war for nurses. Now, this shortage is creating another problem where people are quitting.
But if you show up and you're supposed to be in a facility that has 10 positions filled and there are only 6 there, you're doing the work of those other 4 positions.
But overall, the healthcare industry is having its own emergency. Healthcare Brew reporting this month, more than 4 million workers left the healthcare industry in the first 8 months of this year alone, 20% of the entire workforce. That's what that number represents. Shortages, of course, as we said, resulting in more quits. One poll and Connect RN collecting information from over 1,000 nurses. The #1 reason nurses gave for quitting: staffing shortages, followed by better work-life balance and their own mental health, Jan.
All right, Angela.